Guys, welcome back to Medical Coding with Blue. Today's episode is all about, does an RHIA or an RHIT need to have a medical coding certification? If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, I got a couple of back-to-back comments from some degree holders asking this very question. Do they need a medical coding certification? And if they do, which one would I recommend? So here we go. But first, let me say this. Let me explain what an RHIA is and what an RHIT is. So an RHIA is an individual who has completed a Bachelor of Science in Health Information Management program. And of course, they go to the American Health Information Management Association, apply to take the RHIA, Registered Health Information Administrator designation. And that's what that is. Now, if you have an associate's degree in Health Information Technology, now that is the RHIT, the Registered Health Information Technician. So that is the associates, and the RHIA, the Registered Health Information Administrator, is the bachelor's. So that out of the way. Both of those are offered with the American Health Information Management Association, okay? I will be leaving the link for that in the description box below. So if you have any questions about those degree designations, please be sure to check with AHIMA. So that out of the way. The reason that I would recommend that an individual who has that, either one of those degree designations, I would recommend them getting a medical coding certification is because oftentimes those individuals are in leadership positions. And because they are in leadership positions, and they're often going to be put into a position where the buck is going to stop with them. The buck stops with them. So they often are called in to settle a disagreement between an auditor and a medical coder, and they're basically the tiebreaker. And so it's very important for them to at least understand what is happening. I have seen many degree holders that don't have medical coding certifications that still struggle with basic things about medical coding. And I think to be a very fluid leader, it is very important to have that knowledge. Medical coding is a completely different language. It is a big responsibility when you look at everything that a medical coder can do, right? Because if you select the wrong codes, that's a lot of money that's being paid back, and that's a lot of trouble, right? And then if you do it well, then of course everybody's thriving at that point, right? But again, it's a very sensitive thing when a medical coder either knows what they're doing or they don't know what they're doing. So that's why I say it's important for these leaders to have a medical coding certification so they can at least understand if they're being confronted with, okay, we can't come to an agreement as an auditor and a medical coder, please break this tie. And so to be able to do that in a very objective sense, they need to know what they're doing. If you look at the syllabus for any health information program, whether it's an HIM program or HIT program, Health Information Management, Health Information Technology, if you look at the syllabus for that, you will see that a lot of it is concentrated on the law and regulations and dealing with people, and basically because that's what they do. They deal with the people, and they deal with the regulations, and they deal with the law and all of these things, and data and analytics and statistics, and that's what they do. So that's why it's important that when you're getting into this industry and you don't really know what you're doing at all, it's best not to start with a degree program. A lot of people get sucked into these degree programs, and they are sucked in by these recruiters from the school. Oh yeah, that's how you make more money, or that's what all the employers are looking for. Wrong. They're looking for medical coding credentials, yes. And while it's great to have an RHIA or an RHIT, if that's what you want to do, if it's not what you want to do and you just want to be a medical coder, that's a very expensive way to become a medical coder, number one, because of the time that it takes to get a degree, period. And then two, not really knowing what you're getting into, and then not getting enough training in this college program because of it. And so again, you're having to go through and spend all this money for this degree, not knowing what it is, and then having to get out and really not knowing what's happening, except for, oh, I understand the the law side, I understand the statistical side and the data side, but I don't understand the coding side. And so that's where your missing piece of the puzzle is coming into play. So if you are interested in this, and the two back-to-back said, new subscriber, I'm glad I found your channel. I have my RHIT, but I'm looking to get into coding and obtain a coding certification. I appreciate your honesty and recommendations. And then the other one said, thank you so much for this information. I am currently looking to learn more about surgical coding. I have an RHIA credential, and I was wondering if I need a CCS or a CCSP. So here's the thing when it comes to which one should you get. If you have a degree designation and you want to get a medical coding certification, which one should you get? Now, the CCS is the gold standard of medical coding credentials. This says that you have mastered inpatient and outpatient coding. There is also the CCA, the Certified Coding Associate. Now, this says that you have the entry-level competence to get into the field, that you understand inpatient and outpatient coding. There is nothing wrong with the CCA. There's a lot of trash talk in the industry because there's a lot of ignorant people out there. Well, I am here to tell you that I had the CCA for well over 13 years, and I would still have it today if I didn't have things going on in the back. But because of that, I had to put my CCA to bed, and I was very sad about it because to me, I've always wanted to prove that this is what a CCA can do. And I've changed hearts and minds, in my area at least, about the CCA, because there's a lot of people that don't know it and they don't understand it. They don't know what it's for. And so they'll go around talking ignorantly about it. And the thing is, guys, if you're not educated on what you're talking about, you shouldn't say anything at all, right? Because when you look at the requirements for the CCA, as far as like what they're being tested on and their domains, the CCA has the most domains being tested on for any of the certifications, and this includes the CCS. And so that's something that you guys got to pay attention to. Yes, the CPC has a bunch, but when you look at it, it's just all the subjects broken down. When you consolidate it, it is just CPT. CPT and, of course, ICD-10-CM and all the other things that are listed, but it can be consolidated into a few domains. So that's something that you have to know. But with the CCA, it's covering a lot of different things, because this test is saying that this individual has that competency to be able to code for the inpatient side or the outpatient side. And while it is only a 2-hour exam, this exam packs a punch, and it is not an easy exam to pass either. When I took it, there were 35 people in my class. I was the only one to pass it on the first try. So that's how difficult that test is. Now, imagine this junior test being so difficult. The CCS is even more difficult because this is the mastery of medical coding. And this says that you have mastered inpatient and outpatient. And this says this is a 4-hour exam. It is a 4-hour exam, and it is a quick 4 hours. The time goes by warp speed. All right. So I got my CCS in 2021. I got it again because I had to put my CCA to bed, but I did get my CCSP first. I do currently hold both credentials. And the reason that I hold both credentials is because I got the CCSP first. Had I not got the CCSP and went straight for the CCS, naturally I would have just had the CCS. But because I got them both, I'm going to keep them both. Anyway, but the difference between the two, the CCSP now, so you can get the CCA or you can get the CCS. Either one. Along with your degree designation, you're still good to go anyway. Because again, the concentration of your position, if you're going to go for those leadership positions, is not going to be heavily dependent upon the coding, but you do need to understand it. Okay, so that's what I'm saying. You can go with the CCA or you can go with the CCS. If you go with the CCS, I am telling you now that you have to really know your stuff and you've got to read fast. It's the same thing with the CCA, okay? But the only reason that I say the CCS, because the CCS is longer, okay? So you have to really build up your endurance. And I've done videos many times about what to study for the CCS, how to study for the CCS, even the CCA or the CCSP or the CPC. So they're all out there, guys. My study tips are universal. Okay, so all of these things apply to all of them. So again, you can go either way if you want to do that. I think it's good for somebody who has those degree designations to get either a CCA or a CCS, because again, this exam is covering both sides of the house, the inpatient side and the outpatient side. And so to be a good leader, you have to know the language of everything, not just one language, right? Which if you're going for the CCSP or even the CPC. CPC is a Certified Professional Coder. That is a medical coding certification with the American Academy of Professional Coders. Now the CCSP, the Certified Coding Specialist Physician Base, is also a credential offered with the American Health Information Management Association. This says that you've mastered outpatient coding. So it is only outpatient coding. It has nothing to do with inpatient coding. So that's the thing. That's the only thing about that. And again, the CPC from AAPC covers only outpatient as well. Now, if you want to cross lines and go over to AAPC to get their CPC certification, just know this, all right? They do have a requirement on their CPC, if you have no medical coding experience, that you're going to carry the apprentice status for 2 years. You can eliminate this by going through an approved AAPC program. That'll knock the 1 year off. And then if you pay for their Practicode, that is an educational product, and you complete it, you can have the apprentice designation taken away, all right? If you don't go through an approved program through AAPC and you just complete Practicode, then you'll have to be a medical coder for 1 year, and then they will take off the apprentice status, all right? So you can either have a year knocked off or have both years knocked off so that you don't have to have that apprentice status. There's nothing wrong with the apprentice status, guys. You don't have to have the Practicode. You don't have to, do all these things to get it removed so quickly. No one will hire you. People hire CPCAs all the time. And guess what? Even if you do get the apprentice status removed, you still have no experience. So why are you such a rush? So that's the only thing I'm saying, guys. You still have no experience if you have that apprentice designation or you don't, right? If you do or you don't, you still have no experience if you're brand new. So that's the thing. Don't be so quick to spend so much money thinking that you need it, because no, you don't. People get hired with CPCA all the time, all right? Just like people get hired with the CCA all the time too. But yes, so if you want to do that, if you want to go with AAPC for your medical coding certification, by all means, but also know this, it is I think it's $200 now. It's a little over $200 now for their membership dues, right, with AAPC, because last I heard it was $190, but they said it was going up to like a little over $200. So you have to look on the AAPC website. You have to pay that every single year you hold your certification, or they will revoke your credential. That is a requirement with AAPC. With AHIMA, they do not have the requirement. You are not required to be a member of the American Health Information Management Association, but they will charge you a separate fee when you are reporting your continuing education units. So that is something that you got to know. And for all the continuing education unit information, you can find that on the AHIMA website. Again, I will be leaving that link in the description box below. So when you look at me in the little box, you can see in the little corner where there's like a plus or something like that, where you can click on, and it's got all the description there. And it's got everything, all the links for everything that I recommend in this video. So that's where you can find more information. But yes, by and large, my recommendation is that you get either the CCA or you get the CCS, because again, you need to be able to answer to both sides. You can't just say, well, I don't know about inpatient coding. Are you going to really leave that up to somebody else if you're the leader, right? If you are the head of the department and somebody else, has to ask you a question, are you really going to leave it up to another person to say yay or nay? Even though they may be a good coder, they may know a lot, but if you don't understand the language, again, how do you know what the person is saying? So I would strongly recommend for my degree holders out there, get your CCA or get your CCS. And so that way you can have that knowledge. It never hurts. More knowledge is key anyway, guys. If you are on the verge of getting into a degree program because you think it's going to make you more money and this is what you need to get in and no one will hire you if you don't have a degree, that's not true. In the health information field, medical coding certifications hold just as much weight, if not more, sometimes than the degree designations, believe it or not. I have made more than degree holders who work in medical coding positions. All right, I want to make that clear. Because a lot of people say, well, no, at my facility, I have a degree and I make more than a medical coder. I don't think that's true because I have been in the industry long enough, been in 14-year veteran. And, you know, yeah, from what I've seen, and I've always outpaced people who have degrees and, you know, they're medical coders. I still outpace them. And I had my CCA at the time. So it really all depends on where you are. It really depends on your knowledge base. It's not about that you're coming in with a degree. It's not about that you're coming in with a slew of credentials that you think you're going to be able to make more money. It's about what you know. Medical coders have to understand and know things. We have to know what doctors know while never having gone to medical school. That's my saying, guys. That's my saying because it's true. Think about this. We're reading this stuff all day long and we have to be able to interpret it into codes. And it's not about just pushing through what the doctor has already selected because that's the code that they want. If the documentation does not support what they have selected, then it is our job as medical coders to make sure that the codes they go through are correct and correct those codes and educate those providers on the things that we're doing because again, you know, they don't know and they're not designed to be medical coders. They're designed to be doctors. Let them worry about the doctor stuff. We need to do the coding stuff. So we need to make sure that that documentation looks good. And that's where that education comes into play. The education, before anybody says, well, I thought we weren't supposed to do that. No, we are supposed to let them know, like if they're missing basic things, like if they don't know how to document when it comes to wounds. Let's just say that they say, okay, I did sutures, okay, but okay, how many layers did you go through? Did you have to, you know, was this a complex repair? Was it a simple repair? How big was the wound? Sometimes they don't know to document those things. I mean, they don't know to document the size and that kind of thing. So if you have a provider who's having that issue, that's when you talk to them about it. You're not going to say, well, you're going to pick this and pick this and pick this. No, we need to tell them what is it that is needed for this, right? What is the detail here? If I have a provider that comes in and documents, we put the patient in a cast. Okay, there's a fiberglass cast and there's a plaster cast. There's also another, like a whole variety of things that could possibly mean. So what did you do? Give me some detail, right? And there's nothing wrong with asking for detail, all right? Because that's at the end of the day, that's where it is. And again, back to the subject at hand, it is about understanding the details, knowing about the codes. Because if you are in a leadership position and you are running reports on these different diagnoses and different procedures, if you don't understand them and you don't have that wherewithal to be like, okay, well, I'm going to figure this out because, you know, I'm going to learn what they know so that way I could be just as educated and prepared. You know, guys, you could be potentially missing out. So that's just something that you have to know. But for some people, they've gone their whole careers with just an RHIT or an RHIA. They're a coder. They're happy about it. They don't have to, they say, I'm not going to get a medical coding certification. And if that's you, that's fine. But I'm talking to the new folks. I'm talking to the new folks that are out there and that are wondering if they should or they shouldn't. And I'm always going to recommend it because, again, I'm not about recommending extra things so that these companies can make more money. I am about recommending things that's going to benefit the coder, is going to benefit the HIM professional or the HIT professional, because at the end of the day, that's what my channel is for. My channel is for you all, and for you all to be really good at medical coding, to be strong medical coders, to be fine medical coders, not just, hey, I'm going to talk to people about cattle herding them through and, oh yeah, you know, you can do it and things like that. When I say people can do things, I really do mean it. I mean it in a way that it's going to benefit them if they're paying attention to all the things that I'm recommending. The books, the links, and all the study habits and things that I have, those are the things that, hopefully if you're following along, you'll follow those and it'll help you to become a better medical coder, because it's very easy to get lost in this field quick. And that's not just for coders, that's for the degree holders too. There's a lot of people who end up getting the degree designations and then they don't have any idea what to do with it because they didn't do their research or no one told them. Well, I'm telling you now, if you're feeling lost, get a medical coding certification. You were able to pass that degree designation. It is the same thing that you have to do when you are going for these medical coding certifications, and it never hurts. And all you need is one. All you need is one, all right? You don't need a slew of them. You don't need a bunch and, stuff that's already just kind of repeating itself. Now, if you end up getting like the specialty ones for like healthcare data analytics or for CDI, clinical documentation integrity, that's okay, because that's completely separate from medical coding. That's more on the health information side. So that's something that you have to know. But take the time to do your research before you start adding on all of these other credentials, and just make sure to know that, when you have these degree designations, it doesn't necessarily mean that you've mastered medical coding. Getting the mastery, the CCS does, but just having a degree is really great. But again, it's for our leaders, and their responsibilities are different from a medical coder. So that's all I'm going to say. But I'm going to wrap this one up. Thank you guys so much for joining me. If this video was helpful for you, I hope that you will like, subscribe, and share. And I will see y'all next time. Bye.